sort of the new wonder, sort of vitamin that is one of my favorites now. So this is a short list of things that it helps in. Aids in cell differentiation. It actually inhibits the uncontrolled proliferation of cells, which are likely then to develop cancer if you have uncontrolled proliferation of cells. It boosts your immunity. It's a very potent immune system modulator. It inhibits autoimmune disease to developing. It has a role in insulin secretion, blood pressure regulation, many sort of roles that it plays in the immune system. The role that's more important to me tonight is that its role in helping boost the immune system through an illness. Now, my recommendations on dosing, if you have the recommendations of the AAP for anybody who is just, has infants, they're breastfeeding, 400 IUs, which is international units. That's the standard dose for healthy kids in the summertime, for babies. So there's baby vitamin D, there's adult vitamin D. My recommendation is to double that in the winter and do an 800 international unit to start for anyone who's healthy. When they are sick, you go up to double that. So we're talking about a 1,600 international unit of vitamin D for babies all the way up through young children, say up to about the age of 6. If you have someone that's sort of that 8 to 10-year-old or older, I consider them more of an adult dose. And granted, you cannot overdose on vitamin D3 unless you have 10,000 international units of D3, activated D3 for children, and if you have 50,000 international units as an adult. So to me, it's a win-win situation that you, I have tested vitamin D in my office, and there are 80% of the kids that I test are vitamin D deficient. So if you're already deficient and you get your first cold of the season, and it takes 6 weeks for you to rebuild your vitamin D stores, and then you get the flu, you're already in the dumps, you haven't recovered from your first cold, there's not a reason for you to start at a 400 international unit. There's not even a reason to start at 800. Start at a good dose to boost their immune system and get them out of the dumps. Like I said, it helps to it helps boost your immunity, and that's what you're trying to do at the onset of any virus. Now, vitamin C, I've mentioned that a little bit as well. Vitamin C is a powerful antioxidant. Everyone knows, okay, when I get a cold, I'm supposed to drink my orange juice, I'm supposed to have my vitamin C. That's a very small part of this immune system sort of protocol when you get a cold. I would eat fruit. Fruit is a great source of vitamin C. A lot of the vitamin C that you can get over the counter is not real vitamin C. It's ascorbic acid, and that's not real C. So as NutriWest is here tonight, they have some products that we will start carrying in my office that is real vitamin C, that has great synergistic properties with lots of different things in there. And they'll come up later today to talk about their products. It is involved in many different processes, including production of white cells and antibodies and interferon, and all of which are important in fighting the viral illness. It also has several other properties that are very helpful. Now, echinacea, I use echinacea in combination with things like echinacea elderberry or echinacea vitamin C. You'll see that, but I hesitate to for someone to be on it long term, because it does have a tolerance that builds up. You shouldn't use it for more than 10 days if you're trying to treat something, and you shouldn't use it. You'd sort of use it a 3 weeks on and 1 week off type of thing if you were doing it long term. It also has a theoretical contraindication if you have ragweed allergies. So now there are going to say a few more things about the oscillococcinum. This is the study I was referring to. 63% of patients receiving it showed no symptoms or clear improvement versus placebo, and no adverse reactions, no preservatives, no artificial additives. I have a lot of autistic kids. I have a lot of kids with neurologic problems in my office, and the one one thing I don't want to do is give them medications that actually might make their symptoms worse. So the fact that I can guarantee that there's no reactions to this and there's no preservatives and things, I feel much safer using some homeopathics in those very special kids. Now, say you have the flu. We talked a little bit about, my protocol, which is sort of threefold. The oscillococcinum, which is it's 3 times a day for 5 days if you have the flu. If you get exposed to the flu, you take 1 vial of it, and they're little pellets. You take it once a day for 5 days. If you have the flu and you're doing the oscillo and it's only 63%, sort of curative, then adding those other 2 things, the high-dose vitamin D and adding an immune booster like the elderberry, I think it gets pretty close to that 98%. And certainly with the unofficial study we have in our office, we've had very happy parents coming back and saying this was great treatment and their kid was better. My son had the flu 3.5 weeks ago. He had the 103. He had the chills. He had every symptom of the flu. We tested positive for flu A. I didn't run off and get Tamiflu. He did the oscillo. He did an immune booster. He's 10, and he did 4,000 IUs of vitamin D. And he was better with afebrile. He had no fever in 24 hours. He had a lingering cough, which is what this flu has been very prominent. It's a prominent part of this flu. He had that lingering for 1 week. But we continue to do vitamin D. And I tell my kids, I have a 7-year-old and a 10-year-old, I tell them, there are kids dying out there, and there are kids on the news, and you cannot take your health for granted. So I have him not fussing at all about his supplements now, because before I could not take, he would just forget, and he says, Mom, where's my vitamin D drop? And that's the last thing we do on the way out the door. So Influenzium is, a lot of people ask me, should we get the flu shot or not? I think it's personal choice, but there are other options for you. I personally don't feel that the swine flu vaccine is studied enough for my comfort level, but that is a personal choice. I think that we certainly recommend the regular flu shot, but some of my parents choose not to vaccinate at all. I think this season you have to do something. Influenzium gives you a really good option as a homeopathic. They create this every year. I think they're shipping, it's the same company, Boron, that's the same company that makes the oscillo. Every year they create it. It is a homeopathic. It works by giving minute amounts of the virus to the body so antibodies can naturally be produced in advance of the exposure to the disease. Now, it should be shipping in the next 2 weeks or so to the health food stores, and that would be a great option for you. You take 4 pellets once a week during the flu season. If you have kids and they can't take pellets, you can dissolve the pellets in water and then give it to them in a syringe or in something. Okay. Okay. On the back counter, you may have seen a handout from the Oxford University as well about Tamiflu. And Tamiflu is a treatment, like I said, only for 2 and under, and only for those kids that have medical problems that are chronic and certainly put them in a high-risk category. Oxford University had a statement that said the 1-day reduction in symptoms of the flu does not outweigh or basically does not mean that is a very safe thing to do. So the Tamiflu has many side effects. I have had personal friends who have had Tamiflu and have had extreme nausea and vomiting, odd rashes, insomnia. I have had many reports of hallucinations with the Tamiflu, confusional states, anxiety, a lot of stomach cramps and things. It's not a benign drug. And so when there sort of over prescribing of Tamiflu, I just cringe because there is another way, and I would encourage you to open your minds to that way, especially when the symptoms are so great, or the side effects are so great with Tamiflu. It is a neuraminidase inhibitor. It works by alternating the virus aggregation and release. It's supposed to shorten the duration of the flu. The problem is, if you don't catch the flu in the first 24 to 48 hours, it doesn't work. So if you're not focusing on boosting your immune system to help you fight something, and you're relying on that Tamiflu to stop that virus, I think that you'll be very disappointed in your symptoms not getting better. So, a couple other just different ways we treat things. Ear infections are one of the things that I think I got so frustrated with in my old practice. It seems like I could count on every day somebody being referred to the ear, nose, and throat doctor for ear infections, getting ear tubes. And we would have our short list of antibiotics that we could prescribe. And I remember going into the office and saying, should I choose Augmentin, or should I choose Omnicef? Should I choose amoxicillin? Should I choose Zithromax? And that was the only decision I really needed to make that day on ears. And then which ENT to refer them to if they weren't getting better. Our office, I can count probably on one hand how many kids we've actually had to refer in the last year for ear tubes because of the way we do things differently. That includes from the get-go recognizing that food allergies are highly related to ear infections. Cow's milk, 1 in 5 kids does not tolerate cow's milk. So to change the formula or to get them off a food that they might be allergic to has been foundational in a lot of kids getting better finally. If we have kids that just have a simple first ear infection, there are other ways to treat it. We've used some colloidal silver, which has antibacterial and antiviral properties. We've used garlic oil eardrops that basically, if the ear infection itself is caused from the inflammation and the blockage of this lymphatic drainage out of the ear, then to eliminate that inflammation in the ear by using garlic oil, which is a potent anti-inflammatory, antiviral, and antibacterial drop directly on the ear, it actually opens the eustachian tube up and allows the fluid to drain out of the ear rapidly so that that ear infection resolves. Now, I'm not saying we don't do antibiotics. I certainly have had several that need an antibiotic. But if we have now that second ear infection or that third ear infection, we're going to really seriously be looking at maybe a chiropractic evaluation to get them adjusted so that eustachian tube can drain. Or we teach you how to do eustachian tube massage to get the fluid to drain back to the throat where it belongs. Or doing a food allergy testing to find out what they're allergic to. Okay, so there are different ways that we certainly treat ear infections as well. Now, eczema, I was also very frustrated with eczema. When I read now both sort of types of literature. I read some integrative, I read some holistic, I read some, and then I go back to my traditional medical journals, and they have blatant statements on there that say eczema is a chronic disease.